So we'll start with personality disorders. And the first of them is antisocial personality disorder. There are two main types of personality disorder that are important for Plab 1. One is anti-social personality disorder, and the other is borderline personality disorder. Antisocial personality disorder, it is more common in men because, as its name indicates, it's an antisocial personality disorder. The personality of the person is antisocial. The person with this personality disorder, he usually does not follow the rules. He do criminal acts. There is impulsiveness, aggressiveness, that is indicated by repeated physical fights or assaults, and reckless behavior, consistent irresponsibility, and lack of remorse. Comparing to antisocial personality disorder, borderline personality disorder, it is common in females. And the features of borderline personality disorder, it include unstable interpersonal relationship, mood swings, more impulsivity, self-harm attempts. So in borderline personality disorder, the person usually harm himself. While in antisocial personality disorder, the person usually harm others. That is indicated by repeated physical fights or assaults. Chronic feelings of emptiness, inappropriate or uncontrollable anger, dramatic attention seeker. So these are the features that are present in borderline personality disorder. Some features are common to both, that is impulsiveness and anger. These are common to both of them. The main difference between antisocial personality disorder and borderline personality disorder is that in borderline personality disorder, the person usually hurt others by repeated physical fights or assaults, and he is reckless and he has no remorse on his behavior. While the main features of borderline personality disorder, uh, it is more common in females, and usually the person harm herself, and she is usually a dramatic attention seeker. So a male with past criminal records, aggressive and unstable relationship, antisocial personality disorder. A female with unstable relationship and harming herself and suicidal attempt, borderline personality disorder. Now let's do some examples. A 40-year-old man was present for breaking windows of a shop and hitting the salesperson on the head. So it is a man, so it will most likely be antisocial personality disorder for breaking windows of a shop and hitting the salesperson on the head. So criminal act is a history of criminal act is also present. He has criminal records with many previous convictions and had been imprisoned several times. There is a past history of criminal records as well. He has 2 children and an ex-wife, but he never contact them. So unstable relationship. He has 2 children and an ex-wife that he never contacts them. And the criminal record in a man, the diagnosis will be antisocial personality disorder. In borderline personality disorder, there is usually no criminal record because the borderline personality disorder person usually harm him or herself. Let's do another example. A 20-year-old female brought to the emergency department by her boyfriend. She has multiple self-inflicted laceration on her forearm. So a 20-year-old female with multiple self-inflicted laceration on her forearm, She is anxious, distressed, and constantly say that her boyfriend will leave her. So this is borderline personality disorder because it is a female and there's a history of self-harm or suicidal attempt in order to gain attention of her boyfriend because she think that her boyfriend will leave her. So attention seeking behavior
Well,
in a
something like a sympathetic attention, or is it just that to gain attention of any kind, like a
uh,
sympathetic
can
type
you
of?
please
I'm just saying that is it this person like with borderline personality disorder? Is the person is trying to gain attention like for sympathies, or it's just that like just to get
in
an
general
attention
to yes
in
to get
general?
an intention in general, not
Okay,
just sympathy.
okay.
So from these two examples, we can see that in antisocial personality disorder, there's a history of criminal record and it is common in males. And there's a history of self-harm and it is common in females. Then it's borderline personality disorder. A 40-year-old male had an appendectomy 1 week ago, but returned to the hospital and started yelling and shouting as he was in pain due to operation. He shouted on the surgeon face, "You did not do the operation correctly, and you did not tell me that it can cause discomfort." Then he spitted on the surgeon face and said bad words and left. 2 weeks later, he met the doctor on the street and approached him to apologize, thank him, and say that he is better now. So, is it borderline personality disorder or it is antisocial personality disorder?
So this is antisocial personality disorder because
So, it is a male.
with
What other features of antisocial personality disorder are present?
he's aggressive, and he just later on he realized that it was not a good act, so he did
So,
apologize.
we discussed in antisocial personality disorder that the person with antisocial personality disorder lack remorse. There is
Remorse,
lack
yes.
of remorse. But this male, he is showing the features of remorse because he met the doctor on the street and he approached him to apologize, thank him, and say to him that he is better now. So, in borderline personality disorder, we saw that there is inappropriate or uncontrollable anger.
Right.
So, can we say that he shouted on the surgeon face that this is inappropriate or uncontrollable anger?
So this
Plus,
is
there is
more
no history of the yes. This looks like borderline.
borderline.
Borderline personality disorder
Yes.
because there is no history of criminal records, which is a main feature of antisocial personality disorder. Because there
Right.
will be history of criminal acts
Yeah.
and lack of remorse. So that's how they can distract you by giving a male with these features
Right.
and a female with these features. So other than males and females, other than gender, you need to look for other features as well to make a diagnosis of antisocial personality disorder or a borderline personality disorder. So yes,
Right.
it's a borderline personality disorder, very impulsive, inability to control anger, mood swings, and there is remorse. In antisocial personality disorder, there is a history of criminal acts, and there's lack of remorse and
Remorse.
physical fights with others.
So like
In 19
there
year,
remorse, that
yes,
means like he later on realized that he didn't do the right thing. That means there is
yes,
no.
yes, yes,
Okay.
yes.
Okay.
If he realized that he did not do the right thing, then it means there is there's a presence of guilt or
Okay.
remorse.
Remorse. Yeah.
That's why he approached the surgeon to apologize.
Right.
A 19-year-old male was sent to jail as he has recently set his father's car on fire. So now you can see that this male has a history of criminal act. He does not feel remorse or guilt. He finds it difficult to stick to the social rule. So this is a straightforward scenario of antisocial personality disorder. A lady argued with her boyfriend and she cut her wrist. She also drinks so much alcohol. She has intense mood swing but does not want to die. The likely diagnosis. So a lady has a history of fight with her boyfriend. She cut her wrist, self-harm. This is borderline personality disorder. So a young man gets agitated and violent in the department. Medical history has yet to be obtained. What is the most appropriate medication to prescribe?
Lorazepam.
Yes, because the patient is young and the medical history is not known yet. So the drug of choice will be lorazepam. If the patient was elderly and the medical history was known, and there is no medical history of Alzheimer, vascular Lewy body dementia, or Parkinson, or MI, uh, then we could have given haloperidol or olanzapine. Now, another type of personality disorder is paranoid personality disorder. We discussed antisocial personality disorder and borderline personality disorder. Now, a third one is paranoid personality disorder. Hypersensitivity and an unforgiving attitude when insulted, unwarranted tendency to question the loyalty of friends, reluctant to confide in others, preoccupation with constitutional beliefs and hidden meaning, unwarranted tendency to perceive attacks on their character. So a person who does not trust his friends and he has an unforgiving attitude and he is reluctant to tell his secrets to others because he's always in a paranoia. So we'll label this as paranoid personality disorder. So someone with unforgiving attitude who questions the loyalty of his friends and he's reluctant to trust others and telling them his or her secrets, then this type of personality is known as paranoid personality disorder. Now, another personality disorder is histrionic personality disorder. What is histrionic personality disorder? Histrionic personality disorder is common in female. A woman presents so there's a slight difference between histrionic personality disorder and borderline personality disorder. In borderline personality disorder, uh, there was an attention-seeking behavior in a female, but there was a history of inappropriate anger and history of self-harm or suicidal attempt. While in histrionic personality disorder, the women usually only seek attention. Commonly, the scenario that will be asked in Plab 1 exam is that a woman presents to her male family doctor wearing a low-cut top and a short skirt. She tries to flirt with the doctor. The consultation is filled with drama, and she becomes annoyed with the center when the center of attention shifts from her. So this is known as histrionic personality disorder. that in order to gain the attention of her male family doctor, she wear uh, low cut top and short skirt, attention seeking dressing, and she tries to flirt with the doctor. And when the attention is shifted from her, she gets annoyed. Now, another type of personality disorder is narcissistic personality disorder. What is narcissistic personality disorder? It is common in middle age. It is common in male. Usually, a middle age male will comes in for a review after having trouble at work. In the question, there will be mention of a middle-aged male manager that comes in your clinic for a review after having trouble at work. He will say that his colleagues find him arrogant, cutthroat, and lacking empathy. He seems to be aggressive, his own importance to the company. Sorry, he seems to exaggerate his own importance to the company and seems preoccupied with success. So a male whose workers thinks or whose colleagues thinks that he's arrogant and lack empathy, and he always exaggerate his own importance and always seems to be preoccupied with success, then the diagnosis will be narcissistic personality disorder. In paranoid personality disorder, the male has an unforgiving attitude, and he because there is paranoia, so he questions the loyalty of the friends and reluctant to trust others. While in narcissistic personality disorder, the person will be lost in himself. His colleagues will think that he's an arrogant person and he lacks empathy, and he will be seem to exaggerate his own importance, and will always be preoccupied with success. Another personality disorder is avoidant personality disorder. Avoidant personality disorder is when a young woman complains of feeling lonely. She has she will give a history that she has stopped seeing her old friends as she is worried about not being liked or criticized. So a woman who gives you a history of being feeling lonely and that she has stopped seeing her old friends because she is worried that she will not be liked or criticized, then the diagnosis will be avoidant personality disorder. Now, conduct disorder is commonly diagnosed in adulthood. Conduct disorder means the person with conduct disorder will exhibit disobedience of authority, aggression, antisocial behavior in multiple places. For example, initiating physical fights, bullying or threatening others, using a weapon to cause harm, physical cruelty to humans or animals, stealing, breaking into someone else's property, forcing someone into sexual activity, setting fire to cause damage, etc. Conduct disorder commonly diagnosed in adulthood, disobedience of authority, aggression, and antisocial behavior in multiple places.
What does that mean, disobedient of authority? Like he's at an authoritative position and he's trying to
No,
rule
no,
the other.
no. Uh, he is not at an authority position. He will not listen to the person who is at an authority position.
Okay.
For example, he will disobey his teachers.
Mm-hmm.
So someone of authority, he will always disobey the person who has the authorities. For example, disobeys his teachers, disobeys his parents.
Right.
Now, oppositional defined disorder. Opposition defined disorder is just like conduct disorder. Conduct disorder is diagnosed in adulthood, while oppositional defined disorder, it is also a personality disorder that is diagnosed in childhood. Again, the child will have an active, defined behavior without serious violation of social norms or the rights of others. So there are two differences between oppositional defined disorder and conduct disorder. In conduct disorder, the person was disobeying the authority and as well as antisocial behavior in multiple places. While in oppositional defined disorder, there is only defined behavior without any serious violation of social norms or the rights of others. It is more common in interaction with familiar adults. Usually, the child will not listen to uh, his familiar adults like his parents or his other relatives. For example, he will be arguing a lot with adults, refusing to do what an adult asks, always questioning rules and refusing to follow the rules, doing things to annoy or upset others, including adults, blaming others for the child's own misbehavior or mistakes. So, this is oppositional defined disorder, that a child that usually is always arguing a lot with adults and refusing to do what an adult asks him to do, and he will be always questioning rules and refusing to follow the rules, and he will be blaming others for his own misbehavior or mistakes. So paranoid personality disorder was that a person is always paranoid and he does not trust his friends and does not confide in others, while schizoid personality disorder is a personality disorder that is identified by a lack of interest in social relationship and a tendency towards a solitary lifestyle. So the person usually uh, tends to live alone because he has a lack of interest in forming social relationship. So these features are present in someone, then we'll say that he has a schizoid personality disorder. Now another personality disorder or another disorder that is important to remember for Plab 1 is seasonal affective disorder. Seasonal affective disorder is related to season. For example, uh, if someone gets depression, in seasonal affective disorder, a person will get depression predominantly around the winter months. So during a specific season, the person will have the symptoms of depression. So if someone's symptoms or depression is associated with season, that he get depressive symptoms in a specific season, predominantly around the winter months, then this will be known as seasonal affective disorder. And the treatment of seasonal affective disorder, because it is a type of depression, so the treatment of seasonal affective disorder is same as of depression. That is, it will be treated with CBT and SSRIs. So this was all about different types of personality disorders. I hope it's clear.